Hello doctors, welcome to Metaclergic Revision Videos Pharmacology series. In this video we are going to discuss neurotransmitters and receptors of sympathetic nervous system. For better understanding, please watch previous videos of pharmacology series. Now let's start today's discussion with neurotransmitters, its synthesis and drugs limiting their synthesis and action. Dopamine, norepinephrine and epinephrine are the neurotransmitters in sympathetic nervous system. The action of different neurotransmitter is at different section of body. For example, in the brain dopamine is predominant in some sections. Now let's come to the synthesis of neurotransmitters. Tyrosine is the precursor in synthesis of neurotransmitters in sympathetic nervous system. Tyrosine is converted into DOPA, dihydroxyphenylalanine, with the help of tyrosine hydroxylase enzyme. DOPA then converted into dopamine by the DOPA decarboxylase enzyme. This dopamine is taken into the vesicle with the help of vesicular monoamine transporter 2. Then in the vesicle dopamine is converted into norepinephrine with the help of dopamine beta hydroxylase enzyme, and stored. On the stimulation by action potential, this neurotransmitter released into the synaptic cleft and act on receptors present on postsynaptic membrane. Some amount of norepinephrine released into the synaptic cleft is metabolized with the help of enzymes known as monoamine oxidase and catechol O-methyltransferase. And some amount of norepinephrine is taken back by reuptake mechanism. Now let's discuss some drugs and their uses. Metyrosine drug is made by methylation of tyrosine and is the inhibitor of tyrosine hydroxylase enzyme. So thus, the inhibiting action of this drug causes decrease in synthesis of norepinephrine, and there is reduced sympathetic effect. This drug is used in pheochromocytoma, also in preoperative hypertension if alpha and beta blockers are contraindicated in heart failure-like cases. Now let's discuss the drugs inhibiting vesicular monoamine transporter 2 and thus inhibiting entry of dopamine into the vesicle and further reduction in norepinephrine synthesis. Reserpine, which is vesicular monoamine transporter 2 blocker used in mild to moderate hypertension, agitated psychotic state. Other drugs are tetrabenazine and their derivatives deutetrabenazine and valbenazine. Tetrabenazine and deutetrabenazine are the drugs of choice in Huntington chorea, also used in tics in Tourette syndrome. Deutetrabenazine and valbenazine are drugs of choice in tardive dyskinesia. Now let's come to the next drugs, which limit the level of norepinephrine in synaptic cleft by inhibiting the reuptake mechanism. Tricyclic antidepressants, serotonin norepinephrine reuptake inhibitors, cocaine are the drugs acting on reuptake pathway. Cocaine is the drug of abuse. It causes increased norepinephrine which can lead to hypertension, myocardial infarction. Cocaine also causes increased dopamine release, which causes stimulation of D2 receptors which gives kick, high. Drug of choice in cocaine abuse is bromocriptine, which has same action as of cocaine. The doses of bromocriptine reduced gradually. This all was about neurotransmitters, their synthesis and drugs limiting their synthesis and actions. Now let's discuss receptors in sympathetic nervous system, their functions on stimulation at different levels in body.
Receptors in sympathetic nervous system are alpha and beta receptors. Both receptors are G-protein coupled receptors. Let's start with alpha receptors. Norepinephrine have more potency to stimulate alpha receptors than epinephrine. Alpha receptors are divided into alpha-1 and alpha-2. Alpha-1 is GQ subtype of G-protein coupled receptor. Their stimulation cause increase in calcium level. Alpha-1 receptors usually located at centrally. Alpha-1 receptor present in blood vessels, where its stimulation cause vasoconstriction. In prostatic urethra, where the effect is increased contraction. In bladder sphincter, increased contraction. In radial muscle of iris leads to mydriasis. In gastrointestinal tract, increased calcium level causes opening of calcium-dependent potassium channels. which leads to efflux of potassium, which causes hyperpolarization of smooth muscles, causing muscle relaxation. In live and skeletal muscles, its stimulation induces glycogenolysis and gluconeogenesis, which leads to hyperglycemia. Now let's discuss about alpha-2 receptors, which usually present on presynaptic membrane. This presynaptic alpha-2 receptors are GI, I meaning inhibitory, subtype of G protein coupled receptor. This alpha-2 receptor is stimulated when there is high concentration of norepinephrine in synaptic cleft. Their stimulation causes inhibition of norepinephrine release. Thus, level of norepinephrine in synaptic cleft is regulated. These receptors are also called autoreceptors as they stimulate itself at high concentration. Other examples of autoreceptors are M1 and M2 receptors in parasympathetic nervous system. H3 receptor in histaminergic system. 5-HT1 in serotonergic system. There are some exceptions of presence of alpha-2 receptors on postsynaptic membrane. Postsynaptic alpha-2 receptor present in blood vessels, which are GQ subtype of G protein coupled receptor, which leads to vasoconstriction. Also postsynaptic alpha-2 receptor present in beta islet cells of pancreas or GI subtype of G protein coupled receptor, which causes decrease in insulin release, which leads to hyperglycemia. Clonidine is the alpha-2 agonist drug, whose slow infusion act on presynaptic alpha-2 receptor, causing decrease in norepinephrine release and by vasodilation decrease in blood pressure. On fast infusion of clonidine, it acts on postsynaptic alpha-2 receptors, which leads to vasoconstriction and there is worsening of hypertension. This is all about alpha receptors. Now let's discuss beta receptors. Beta-1 receptors have more affinity for epinephrine than norepinephrine. They act by increasing cyclic AMP level, which leads to increased calcium level and increased contraction. In heart, it causes increased contraction, heart rate and conduction of heart. In kidney, in juxtaglomerular cells, their stimulation leads to increased renin secretion, which activates renin-angiotensin-aldosterone system, which leads to increase in blood pressure.
Now let's discuss about beta-2 receptors, which are present on both presynaptic and postsynaptic membranes. First, we will discuss beta-2 receptors present on postsynaptic membrane, who has more affinity towards epinephrine than norepinephrine. In smooth muscle, it blocks myosin light chain kinase by increasing cyclic AMP and stimulates myosin light chain phosphorylation, which leads to opening of potassium channels and smooth muscle relaxation. So in bronchi we can see bronchodilation. In blood vessels, vasodilation. In uterus, ritodrine drug, which causes uterine relaxation. But in cardiac and skeletal muscles, beta-2 receptor stimulation leads to increase in calcium level, which causes contraction. So we can see side effects like palpitations, tremors in beta-2 agonist consumption. Same as alpha-2 receptors, beta-2 receptor stimulation leads to glycogenolysis and gluconeogenesis, causing hyperglycemia. But its stimulation in pancreas cause increased insulin secretion, which leads to hypoglycemia. But hyperglycemia dominates over hypoglycemia. So we can see hyperglycemic state in individuals. Now let's discuss beta-2 receptors presence on presynaptic membrane, which are GS subtype of G protein coupled receptor, which have high affinity, so they are stimulated when there is low concentration of norepinephrine in synaptic cleft. Its stimulation leads to increase in norepinephrine release and increased sympathetic effect on postsynaptic membrane. Now let's discuss last type of beta receptor, which is beta-3 receptor, present on postsynaptic membrane, who has more affinity for norepinephrine than epinephrine. In detrusor muscle, its stimulation causes detrusor muscle relaxation, and in adipocytes, its stimulation activate hormone-sensitive lipase, which leads to lipolysis. So this was all about neurotransmitters and receptors in sympathetic nervous system. I hope it makes sense. If you like the video, Please share, comment and don't forget to subscribe my channel. Thanks.